Hi guys, welcome back to my channel. I'm Dr. Veena, a full-time NHS GP working in London, and today we're going to talk about low mood versus clinical depression. Before we get into this video, it's really important to say if you're going through clinical depression or a period in your life where you're so low, you're feeling hopeless, worthless, lots of negative thoughts or having unwanted thoughts of harming yourself or ending your life, you're not alone. It is difficult. There is support available. And here in the UK, there's a 24-hour helpline that you can call the crisis line. I'm going to leave right here. Please feel free to use this line for your services. There can be a lot of life events that happen unexpectedly or expectedly that make us feel low. It could be an illness, a close relative's illness, a bereavement, a breakup, loss of a job, financial difficulty, you name it. We can't predict what happens in this unpredictable world we live in today. This can all impact our mental health, leading to mental illness, and this is something that we don't always pay attention to. Having a period after anything that could have been a trigger where you're feeling low or you're not feeling as energized as you normally are is absolutely normal. It's part of being human. It's part of feeling the ups and downs of life. And it doesn't necessarily mean that you're going to be depressed or you're clinically depressed or that you need to be on medication. If you're having persistent feelings of low mood, there may have been a trigger, may have been no trigger. Low energy, where you just cannot bring yourself to do even the basic things like taking care of yourself, brushing your teeth or combing your hair or getting dressed, showing up to work. Everything seems like an absolute dire chore, or loss of enjoyment in the things that you once used to enjoy. If you were someone who used to love sports and now cannot even fathom the thought of it, if you used to love cooking for your family and that enjoyment has just kind of left you, any three of these symptoms, which are persistently present for several weeks, could mean that we need to look into how you're feeling a bit more. The next thing to really think about is, do you have 4 or more of any of these symptoms? Difficulty falling asleep or early waking in the morning, really disturbed sleep, change from a pattern that you're used to, difficulty concentrating, difficulty following conversation and formulating your own thoughts, a change in your appetite. Are you overeating to numb some kind of negative emotion, or have you completely lost interest in eating and food? Have you turned to substances to numb this pain that you might be feeling? These substances could be things like smoking, drinking, drugs, excessive food, or consumption of things that in the short term make you feel good or great, but in the long term could actually have a lot of negative effects. Some people may also find that they are drawn to activities they may not always have done before, such as gambling or overspending. If you've noticed that there are a combination of any of these habits or symptoms alongside the 3 core ones that we talked about of low mood, low energy, and a lack of enjoyment in the things that you once used to enjoy, we would highly recommend you speak to a clinical professional or your GP to discuss some of these symptoms. A lot of times, psychological stresses can manifest in physical symptoms. You may not realize, but the stress and negative thoughts and impact on your mind could be now showing up in your body as a rash, an itchy rash, abdominal pain, reflux symptoms, headaches, joint pain, general tiredness and lethargy, complete loss of appetite. These are very non-specific symptoms, but this combined with those low mood symptoms, which are persistent for more than 2 weeks, we would really advise speaking to a medical professional. Remember, with clinical depression, there isn't always a cause or a reason. You may have a very happy life. You may have a very successful life. You may have a lot to look forward to, but it might just be that your mind in that moment is just going through something that you cannot describe and you cannot put together what everyone else is seeing, and that's completely fine and that's okay. People think that something needs to be wrong for you to feel depressed, and I'm here to tell you that's not the case. Absolutely, it's not. Yes, sometimes there can be a trigger or a negative event that can lead you to feel some of these things. However, that's really not the case with every single patient. Let's talk about some of the treatments that could help. Treatments can be accessed via primary care through your GP, privately if you have private health insurance, or some activities that you can proactively go and join. So lifestyle-wise, if you have a friend, company, or you have the motivation to go and incorporate movement or some creative activity in your day-to-day life, you might notice massive differences in your mental health. This could be exercise, painting, yoga, weightlifting, cricket, football, anything. Could be a solo activity, could be a group sport. A lot of times, speaking to a counselor or a psychologist can also help process some of these thoughts and help us to identify what either the root trigger causes or how can we break the pattern of negative thinking. This can be one-to-one therapy or group therapy, specifically CBT, which stands for cognitive behavioral therapy. If you are going to get CBT or talking therapies, the treatment is normally between 6 to 8 weeks, where you get treatment for an hour a week with a trained specialist, and at the end you're going to be reviewed to decide should you continue or would you be discharged from the service. There are some factors you can also discuss with your doctor that will make your life a bit easier. If work is adding to a lot of the stress, you may just need either amended duties at work or you may need some time off work. If you need more than 7 days signed off, you can go to your GP and we can write you a fit note. But if it's less than 7 days, you can self-certify and you can just provide that to your employer. The key thing is making an action plan with a professional. Why this helps is you have some accountability, you know that someone is looking out for you, and it gives you something to look forward to in terms of what's next, and you don't feel as hopeless in the midst of all these negative thoughts. There are a range of medication that can also help in conjunction with talking therapies and the lifestyle factors we talked about. There are different ranges. There are SSRIs, SNRIs, tricyclic antidepressants. There are lots of different families of medicines which we could try to see what brings a benefit for you. There are lots of different medications that can actually help you improve and help you feel a bit better. It's important to remember that it's not like a fever where you take a medicine and then you feel better within a couple of hours. A lot of antidepressants take quite a few weeks to build up in your system to then see a positive effect. So it's a matter of really ensuring you comply with it, you're persistent with it, and sometimes they may make you feel a bit worse before they make you feel better, and these are things that your doctor will really discuss with you. With each one that you may try, your doctor may give you a trial for 2 weeks. They may review you at the 2 weeks to see how you're coping with it and then decide should we continue it or should we stop. With antidepressants, like we said, patience is key. It may not be something that you're on for a month or two. You may have to take them for 3 to 6 months or up to 2 years to actually see an overall benefit. However, having said that, it's not something you're going to be on for life. Once you do feel better after getting the extra support, you can discuss with your doctor about weaning down the dose and eventually stopping. You know, when we're physically sick, you break an arm or you injure your face, it's so easy to tell someone, oh, I'm unwell. You send them a picture and there's just that allowance for poor health. I wish that was there for mental illness. Just because we can't see the illness doesn't necessarily mean it's not there. I want to encourage you to speak to someone so your mental health does not turn into mental illness, so that we can actually put in some good routines and practices in place where you can get support, you can be proactive, and you can work your way, not just for yourself, but your entire community to be overall fit and healthy. Some practical tips you could do is reaching out to a friend, sending them a text message, sending them an email, telling someone at work how you're feeling, changing some of the things you're consuming in terms of what you're watching, what you're eating, maybe cutting down some of the sugary, heavy, oily foods. You're going to feel that eating a bit fresher, organic foods might make you feel a bit lighter and more energetic. Trying to even start with getting some sunlight, stepping out, going for a walk, increasing that slowly with improving a bit of exercise, cutting out excessive toxic products such as smoking or excessive alcohol. Those are minor things you could do. But of course, if these thoughts are very intrusive and they're constant, it's not something to manage by yourself. You need to speak to someone, and we are right here to give you that support and help you get from poor health to good health. I hope that this video helped you understand the difference between clinical depression to what could just be a bit of low mood or a normal response to a negative event in your life. I'm going to try my best to answer some questions. If you have some, please feel free to write them below. Thank you so much for tuning in.